Hello everyone, I am Dr. Prashant Patare. I am an orthopedic surgeon and my area of interest is joint replacement and sports injury treatment. And I practice at Mac Super Specialty Hospital, Ahmednagar in the state of Maharashtra. Importance of musculoskeletal health. So musculoskeletal health plays a key role to keep up good mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of life. Okay. So good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. Physical activity has a crucial role in reducing the risk of other non-communicable diseases, and it can only be achieved with adequate musculoskeletal health. What is the relationship between painful musculoskeletal conditions and a reduced capacity to engage in physical activity? Well, an impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitations, proceeding in a loss of participation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life and well-being, including mental well-being. So, an impaired musculoskeletal health can lead to substantial personal, community, and societal consequences, particularly in older people. A strong relationship between painful musculoskeletal conditions, lack of physical activity, and resulting functional decline, frailty, loss of well-being, and loss of independence, as well as depressive symptoms, has been described by several epidemiological studies. An individual with arthritis and musculoskeletal disorders is sure to be lesser active than an individual without arthritis. Thus, lack of physical activity emerges as the most prevalent risk factor associated with functional decline of an individual. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking speed, chair rising, and standing balance. So these things have been frequently linked to increased mortality. So thus, musculoskeletal health is a key component of frailty. What is the impact of impaired musculoskeletal health? The impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. So, with an increase in the global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers, as many occupations and work-related activities are associated with musculoskeletal disorders, like low back pain and shoulder disorders. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. Now, high-income countries observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and lost retirement wealth. While developing countries see musculoskeletal conditions to have a major impact on livelihoods. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at all levels. Since musculoskeletal conditions are chronic, painful, and associated with disability and social disengagement, frequently causes mental health impairment as well, such as depression and anxieties. Like physical and mental aspects of quality of life related to health is known to be greatly impacted in persons with multimorbidity. Unfortunately, this impact is even greater when there is an associated musculoskeletal disorder or some condition. Now, what is the burden of disease related to musculoskeletal conditions? Now, as we know, non-communicable diseases now account for most of the global burden of disease, with musculoskeletal conditions being the leading contributor. Developed countries well recognize the transition of burden to long-term disabling conditions. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal conditions such as osteoporosis, low back pain, driven by population growth and aging. Now, since age is the commonest risk factor for musculoskeletal conditions, it is estimated that by 2050, there will be a 5 times rise in people over 40 years living in developing countries contrasting the wealthier countries. Additionally, obesity, which is another important risk factor for many musculoskeletal conditions, is also hypothesized to rise dramatically in the developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only increasing the sedentary type of lifestyle and reducing physical activity, but also increasing the number of motor vehicle accidents and resulting musculoskeletal trauma and disorders. Now, role of physical activity and sedentary behavior in musculoskeletal health. Now, sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, binge watching seem to be prime contributor. Now, this surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized as a substantial global economic burden. Now, increasing physical activity and optimizing exercise as recommended by WHO is an optimal way to improve musculoskeletal health. Now, evidence shows that the effects of a sedentary lifestyle, for example, a desk job, can be reduced by a small amount of activity every day. And now, according to a recent meta-analysis, utilizing the data of more than 1 million individuals, concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. So thus a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development and progression of osteoarthritis of the knee or hips. So there is a link between adiposity and joint degeneration. Now, evidence suggests that increasing the levels of physical activity will not only increase musculoskeletal health, but also decrease the risk of suffering from obesity-related diseases such as diabetes. Now, what are the WHO recommendations on physical activity? So, nearly 2 hours of moderate physical activity per week, or about 20 minutes of brisk walking per day, is recommended by WHO to maintain good musculoskeletal health. Now, these exercises also elevate your heart rate and are known to be associated with lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvements in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low-intensity physical activity like walking. What is the relationship between obesity and musculoskeletal health? Now, obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of osteoarthritis, which is one of the most common musculoskeletal disorder. Now, the strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis and thus can alleviate some part of the pain because of the condition. So exercise, interestingly, obesity is also one of the most modifiable risk factor of osteoarthritis. So reducing the weight definitely reduces the loading of the joints, which are already degenerative, and it reduces a lot of pain and also improves the long-term survival of the joints. For example, your knee osteoarthritis. So one of the advices we give to our knee arthritis patients is reduce your body weight and reduce those kind of activities which increase the pain. So activity modification. So obesity is one of the most important modifiable risk factor in case of osteoarthritis. And we strongly advise people to lose some kilos so as to reduce their knee pain. So exercise and weight loss have benefited overweight and obese adults with knee osteoarthritis in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and joint function. So, what are the consequences of childhood obesity and physical inactivity? So, a lack of physical exercise in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. So it is very important to look after the musculoskeletal health of the younger ones, the next generation of our country, and advise them to engage themselves into some kind of physical activity on a daily basis and stay away from sedentary activities like video games or watching television for a very long time. So that is important. So the musculoskeletal health, I think, starts from childhood itself, and children should be encouraged to engage into more and more outdoor activities or sports activities so as to develop an healthy lifestyle from the childhood itself. So, thus reducing obesity in children by encouraging physical activity also reduces the risk of uh, developing other non-communicable diseases in their adult life, like diabetes or hypertension in very early adult life. So, again, what is the importance of having healthy diet? So, it is very much related. What you eat, you become what you eat. It is a saying in English that what you eat, you become what you eat. So it is important to look after the kind of diet you take. So it is advisable to have a diet which is rich in proteins. There are good vegetarian sources of protein like soya bean, your different types of dals. Also, taking good amount of fresh fruits is an important thing for maintaining your bone health. Fruits contain flavonoids, and which is an important contributor to the bone health. So we also encourage patients to have their daily dose of fresh fruits and dry fruits, which improves the protein intake as well. Apart from protein nutrition, your vitamin D and calcium supplements are also shown to optimize muscle and bone health and functional outcomes in older people, reducing fall and fractures. So, calcium and protein synergistically optimize bone health. Thus, dietary strategies include consumption of long chain fatty acids, vitamin D and vitamin K, which help in bone and cartilage mineralization and decreasing blood cholesterol. So, antioxidant rich diet also helps athletes improving their tissue repair, which happens at the time of the training. So, there's an interesting term, sarcopenia. So, what is sarcopenia? Like osteopenia, which means the loss of bone mass with age. Sarcopenia means your muscle loss. So, some amount of muscle loss, muscle mass gets reduced with age, that is non-escapable. But with moderate physical activity, your weight training, and good brisk walking improves your muscle mass and helps you prevent losing your muscle mass with aging. So, having good muscle strength and good bone quality, these are very important factors in the old age to lead a productive and healthy lifestyle. Also, in the older age group, it is important to prevent your falls, right? So, fall prevention is also very important. So, we also advise the elderly people to have their refractive errors corrected, to have good atmosphere in the house, so as not to have too many things lying on the floor in which they can entangle themselves and have a fall. So that is also very important. So it is noted that you're rising from your sitting position. So now the importance of musculoskeletal health, as we all know that to lead a good, productive, a fruitful, enjoying life needs good musculoskeletal health. Okay, so as long as we are active and mobile, uh, we can enjoy life. So, as we say, life is motion and motion is life. Because there have been, you must have heard about one story that the archaeologist found one skeleton, remains of one skeleton, whose femur was fractured and had united. Okay, and that individual lived after that. Okay, so that was inference of that skeleton. So, if you see in animal world, if an animal breaks a leg, he is destined to die after that. Okay, so an animal like tiger cannot hunt anymore and is going to die because of starvation. Or an animal like deer, if he fractures his leg, he's not going to be able to escape from the predators. Okay, so breaking a leg in animals is like end of life. So it is called as the start of civilization. So the man broke his leg. Somebody was there to take care of him, and it could unite the fracture, and he could lead further life. Okay, so that archaeological finding suggests and marks the beginning of human civilization. So if we take into consideration the importance of musculoskeletal health, now in the modern world, we are leading more sedentary lifestyle. We are less and less engaging into outdoor activities. Most of our activities are indoor activities, which also reduces your vitamin D level because of lack of exposure to sunlight. So it is important to take a good amount of sunlight, to have regular exercise, which means about 20 minutes of brisk walk daily, or 2 hours of moderate scale physical activity per week, which is recommended by World Health Organization. Also, it is important to maintain a good food habit, in which you try and avoid junk foods, try and avoid foods which only bump up your calorie content of the food and have no nutritional value. So you should try and avoid such foods. You should try and take food which is rich in proteins, rich in calcium, and rich in antioxidants. So taking daily dose of fresh uncooked vegetables, fresh fruits, dry fruits, these are very important to improve your bone health and your muscle health. Also checking your vitamin D level over the period of time, and supplementing your body with adequate amounts of vitamin D is also very important. You can take natural dose of vitamin D by exposing yourself to good sunlight on a daily basis, and also keep an eye on your vitamin D level by your lab tests. So these are the important things in a nutshell. And I wish every one of you to enjoy good musculoskeletal health, so that you enjoy your life to the fullest. Thank you.